In this video, I want to go over what someone can expect with their first visit with Simplify Motion Physical Therapy. The first appointment starts off where I'll come in and I'll usually bring my table just because I don't know exactly what I'll need to evaluate with the first session, right? A lot of times I'll just get some information about your case over the phone, but until I see you, I want to have all my tools with me, so I'll bring this from my car. I also have tools that aren't pictured, but it would be things like resistance bands, measurement tools, blood pressure cuff, all of these things that you may need in a physical therapy office. We would bring that with us to the appointment, or I would bring that with me to their appointment. Now, the big thing that is really important is when I come in, I'm going to take off my shoes. I'm going to ask you where's a good place to put the table. A lot of patients will ask me, where can we do this? Maybe you have an apartment or your home's a little bit small. We can always move things around if we need to facilitate the table. And in a lot of cases, after about the first 4 or 5 questions, I kind of realize maybe I don't need that table and we can just use your home as it is. Also, some questions that come up are things like, if I have a dog, what do I do about my dog or with my kids? The nice thing about home care physical therapy is, or in-home physical therapy, is that you are totally fine having your kids there, right? Dogs, we just ask that they're well trained, right? If you don't trust your dog not to bite us or anything like that, then yes, please keep them in a room or outside or whatever it is during the appointment. Now, we'll sit down. I'll get to know you. I'll ask you some questions about your pain or whatever reason that I'm coming to your home that day. And as we go through, I'll get a little bit of a picture and understanding of, what I might want to look at. And then after I get all that information, then I'll come in and we'll do the objective testing, which we either do on a table or for some conditions I won't even do with a table. And then I'll have a lot better understanding of your case, what's going on, and then I make sure that I provide all of my patients with a good understanding of what I think their plan of care would be. What that means is I really want to make sure that I'm giving them a good understanding of how long this is going to take, right? How many visits or sessions they may have to pay for it to be able to get to where they want to be. But I will always put it in the focus of your goals, what you want to achieve, what are some of the things that you want to be able to do when you're out of this pain. Now, the other thing is, reputation is really important to me. So if I don't think I can help you, I'm going to tell you, right? Sometimes I know that over the phone call, but a lot of times I won't know that until I evaluate you. And the nice thing is, for me at least, I've been a physical therapist for 15 years, and in this town, I've been a therapist for 10 years. So I know every surgeon out there, every PCP, every physiatrist. If you need a physician recommendation, I have a Rolodex of chiropractors, massage therapists, stretch therapists, all these different people that, if we think that that's where you need to be, we'll get you to those people. Then, after we've come up with a plan of care, I'll give you some things to do, right? So almost everything in the musculoskeletal system needs some level of strengthening or flexibility to improve the forces on the joint that's causing pain, right? Or the area that's causing pain. So you will end the session with some exercises, some treatments, some interventions, whatever it is that you can do at home. And I'll give you that as quote unquote homework, right? When I get back to my computer later in the day, I'll send you a printout of all those exercises if you want them. Some people want them, some people don't, but I always offer that as a service, because if you don't do the work on the days in between our sessions, your progress is just going to be a lot slower. It doesn't mean that you're not going to get better without doing that stuff, but it'll just be a lot slower. Some people, from a convenience standpoint, they just say, look, when you're here, I'll focus on PT. When you're not, I won't. Totally fine. It's just going to be slower progress than if they carved out that time every day. You'll get that, and then obviously we'll schedule any further appointments. The biggest thing that you want to look at as what to expect in your first physical therapy appointment is you want to make sure that you have a list of questions for me, anything that you want answered. And just my biggest goal is the therapist coming in is to understand, what do you really want? What's the thing that I need to help you solve? And then we go from there. Nice thing is, because I'm an in-home therapist, I don't have to have 15 people on my caseload in order to make money to pay my mortgage. I have the time to answer text messages. I have the time to answer emails, phone calls even. If there's anything that's a problem in between the sessions, or if you just weren't clear on something, maybe you slept on it and you wanted to ask me another question, all of those things are completely fine, because, as I said, I have a lot more time to focus on patients now that, I'm the one coming into your home. I'm the only one working with you, right? And that'll allow me a lot more hands-on care, right? And hands-on either manual therapy, but what I mean mostly is I get to be able to really take charge of your care versus handing it off to an assistant. And then treatment sessions tend to be a little bit different. What we do with treatment sessions is, because I already know you, we don't need to sit down and have a conversation and do some examination. There will likely be a little bit of a reevaluation each time I come in. For instance, my patients with shoulder pain tend to start about here. Almost always I'll ask them, hey, okay, give me another range of motion. See if you're higher here. I might test their muscle strength again. Anything to kind of give me an idea of where you're at compared to where you were the last time I saw you. But that'll be brief. I mean, maybe a few minutes. Most of the session is about work, right? We want to go and review the home program that you're doing, make sure there's no questions, make sure your form is right, and then add anything based on your progression. So if you're progressing, I'll make things harder. I have bands, I have weights, I have all the things that we need. Some of my patients have in-home gyms, we'll use those, right? Or if you're not getting better, right? If you're definitely not, where you want to be or where you thought you'd be, then we can kind of game plan. Okay, what was going on? Tell me about when this pain started. All those subjective questions that really are important. We have the time to do that in each session because it's just me and you, right? So we will go through all those, and then just hopefully every single session we see some improvement, or at least every other session. My rule typically goes that if I don't see improvement in 4 visits, I completely flip the script. I want to understand what's going on, because it either means that I'm wrong, right? That I've diagnosed you incorrectly, I'm going down a path that isn't the correct path, or there's something else going on. There's something that we haven't seen that maybe we need to change what we think our diagnosis is. Either way, in 4 visits, so for most people that's 1 to 2 weeks, if we don't see some slight improvement in your pain or your symptoms, we'll have that conversation. So the last thing I want to do is just keep drawing it out and say, just work out, you'll be fine. Because you could be getting, maybe you need some other care. Maybe you need an MRI. Maybe you need an injection. Heck, maybe you need a surgery. And we don't want to be delaying that just for the sake of delaying it. With musculoskeletal pain, you should see an improvement within 4 visits, right? So that is just a little overview of what to expect. Again, just to go over it again, we can work in anything. I've worked in studio apartments all the way up to mansions, right? So don't worry about the space. We can figure that out. Dogs and kids, just like as if you'd have any other guest in your house, make sure that the kids almost never are a problem. And then the dogs, just make sure they're not, they don't bite, right? We, just like male men, we don't like to get bit. And then just, carve out an hour. The first session is going to be different than the follow-up sessions. And just remember that doing your homework in between usually makes it better. And then, like I said, the biggest thing is that you have access to me, right? So if there's any questions at all during the process, you can always text or call. So I hope that clears up some things for you for what to expect on your first appointment. And obviously you can always give me a call, go on our website with our contact page if you want to reach out to schedule an appointment to address your pain. I operate mostly in the Phoenix and Scottsdale metro areas. I'll go all over the valley as long as it's not too far of a drive. But I'm primarily located in the Arcadia neighborhood. And just for in-home physical therapy in the Phoenix and Scottsdale area, Simplify Motion is your team.